To time. I'm very happy to introduce Dr. Ghada Samir, Assistant Lecturer of Radiology at Ain Shams University, who's going to talk about the computation fluid dynamics and machine learning based FFR CT in coronary artery disease in an Egyptian population. موضوع طبعا يهمني شخصيا. تفضل.
Glad to be with you today. This presentation is actually prepared by our dear lecturer of radiology, Dr. Sarah Wahid Antawi. I am replacing for this presentation. It will be about the computational flow dynamics and the machine learning FFR CT in the coronary artery disease. As we all know that the coronary artery disease diagnosis is mainly done by anatomical methods like the CT coronary angiography or the diagnostic cast. However, physiological diagnosis for the coronary artery depends on other methods like the nuclear medicine stress test, the stress echo, or even stress cardiac MRI. However, the new FFR method has the ability to combine post-anatomical and physiological assessment for the coronary plaques. It just gives a physiological impact of the plaque, how hemodynamically significant the plaque is. It uses computational fluid dynamics to calculate the pressure difference across the stenosis. It's usually done by invasive catheterization that uses a guide wire to pass the stenosis, and it measures the pressure distal to the stenosis relative to the aortic pressure. And they have found that the cutoff value of 0.8 detects the hemodynamic significance of the stenosis. That means if the cutoff values of the ratio is below 0.8, you have a hemodynamic significant stenosis. However, HeartFlow in 2016 developed a certain softwares that can use or extract the coronary artery tree from the normally performed CT coronary angiography, and such software can calculate the FFR ratio in any point along the whole coronary tree in any vessel. So HeartFlow is the only CTR FFSD that is approved by the FDA, and its benefit is that you cannot use any vasodilator injection to put the that's used in the invasive coronary that put the coronary artery in a hyperemic state. You don't use vasodilator injection in FFR CT. It's mainly used in patients where the diagnosis of the moderate stenosis is in a dynamic state, like the patient having a coronary artery in between 50 to 70% stenosis. For example, this patient has an proximal LED plaque. However, the FFR ratios below this plaque all are in the first image on the right side. You will find that the FFR ratio is above 0.8. This means such lesion is not hemodynamically significant. However, in the other patient, the old FFR ratio distal to the proximal LED stenosis is below 0.8. This means this patient has a hemodynamically significant lesion, so this patient will be benefit from the revascularization. However, the computational flow dynamics is not very perfectly applied in the clinical practice. So some center uses other machine learning FFR CT in order to decrease the cost for such a computational flow dynamics and avoid such a limitation in its availability. Such center uses certain models in order to use certain on-site computers just to extract the features of the coronary artery tree. For example, extracting the features of the length of the stenosis, the radius of the stenosis, and fed such all informations inside the deep learning models in order to provide certain deep learning models to differentiate between the significant stenosis versus the non-significant uses based on the ICA or the invasive coronary angiography results. And many results have been performed regarding such CT FFR, and they found a good diagnostic accuracy of the deep machine learning models compared to the computational flow dynamics and also compared to the invasive coronary angiography. So our future in our future step in the Ain Shams University will be the combination between a large data set of people and the multidisciplinary team with machine learning experts, with the clinicians, with the expert radiologists, and order with the use of high-end machines in order to have our own deep learning models for better planning for the patient, revascularization, surgery, and so on. Thank you.
Thank you, Dr. Ghada. Now it's my pleasure to